All right, good morning, everybody. Happy Tuesday morning. Welcome to Phoenix Children's Grand Rounds. It's my pleasure to introduce our speaker this morning, Dr. Sarjita Shukla. Dr. Shukla is a pediatric hospitalist here at Phoenix Children's. She's a graduate of the Phoenix Children's Valley-Wise Pediatric Residency Program. And in 2018, she completed the Integrative Medicine Fellowship program through the Andrew Weil Center for Integrative Medicine at the University of Arizona. She's going to present this morning a presentation titled The Integrative Medicine Approach to Pediatric Pain Management. And she mentioned that Dr. Shukla is starting a new clinical integrative medicine program here at Phoenix Children's, which will be starting later this year in collaboration with the Outpatient Pain Clinic. Dr. Shukla.
Thank you. So in true integrative style, I actually invited a couple of our colleagues to share their expertise as well. So I want to quickly introduce them to you as well. So first is Dr. Amy Shoptaw. She is a pediatrician, was in private practice and did a lot of integrative medicine in her private practice. And she is now the medical director of our Center for Resiliency and Wellbeing at Phoenix Children's. Which aims to help children who have experienced adverse childhood events. Also, we have Dr. Paula Genovese, who is a pediatrician at Phoenix Children's and is part of both of our palliative and our pain programs, and she does acupuncture as well. She did her pain fellowship at Seattle Children's, her palliative fellowship at Ohio State University, and her medical acupuncture training in Harvard. And they will be sharing more about their expertise throughout the presentation, and will all three be available at the end for questions. So I have nothing to disclose. Objectives are, one, to define integrative medicine, since this is a new emerging field, especially in pediatrics, and then recognize which patients would benefit from an integrative medicine approach, and then help you assess the evidence regarding the safety and efficacy of non-opiate or non-pharmacological treatment strategies for both acute and chronic pain. So what is pediatric medicine, integrative medicine? So the first thing I really want to emphasize is that it is an evidence-based approach to integrating both complementary and conventional medicine modalities. It addresses the whole patient and the factors in their life that affect their health. The emphasis is on prevention and healing, but really it optimizes the full spectrum of health, whether it be health promotion, illness prevention, the treatment of acute disease and recovery, or management of chronic illness and quality of life. It is personalized to the patient's unique characteristics and needs, and it strongly leans on the relationship between the patient and the provider. So integrative medicine as a subspecialty, it is an American Board of Integrative Medicine approved fellowship program that you go through for training. There are about 20 programs in the country, and like Dr. Olson mentioned, we have one right here in our backyard in Tucson through the University of Arizona, and that's where I did my training. And then to get board certified through the American Board of Physician Specialties, you have to have completed training in a recognized medical school, have a valid unrestricted license to practice, have completed residency through an ACGME approved program, and be board certified in your specialty, and then have completed the fellowship program to sit for the board exam. Starting next year, they're actually going to become more strict with their criteria for who they provide board certification to, and will no longer be accepting naturopathic, Ayurvedic, chiropractor, and acupuncture training in lieu of the integrative medicine fellowship. And actually brand new as of this year, there is now a pediatric integrative medicine certification through the Academy of Pediatric Integrative Health. So who uses integrative medicine? According to studies in 2017, the prevalence of complementary treatment use in the US was 12% of children. So that's 1 in 9 of our patients. And that number jumps up to over 50% of kids who have chronic illnesses. More recent studies suggest that that number actually may be closer to 80%. They're more likely to use complementary therapies if there is parental use, if they have multiple health conditions, or if they have decreased access to healthcare and are looking for affordable treatment options. So it's very important for us to be aware of the current data and what reliable resources are available, because our patients are using this. Often they don't reveal to us what they are using because they fear being judged. So being open and asking about it and providing that space to communicate about it openly is also very important. Why do parents seek integrative medicine? One, to support their child's natural healing. They often perceive these therapies to be safer compared to conventional treatments, and often want to try to minimize the use of invasive treatments or prescription drugs. They're trying to explore all available options for their child, and often they're looking for new approaches to chronic conditions. They're really just seeking to decrease the amount of pain and suffering that their child is experiencing. There may be cultural preferences for some of their treatments. And then, like I mentioned, cost-effective treatments, especially if they don't have access to good care. And really, many families now are just looking to promote health and wellness throughout the full life cycle, prenatally and all the way through childhood. Why do physicians use integrative medicine modalities in their treatment options? One is to expand the available options that you have for your patients. We've all experienced that patient where we wish we could have offered something more, or we recognize that they are not achieving their goals for their treatment through the treatment options that we have available currently. We're also seeing an increasing prevalence of chronic illnesses and lifestyle-related illnesses in pediatric populations, and an increase in stress-related disorders in children. And there are quite a few strengths for integrative medicine. One is it builds a very strong foundation of health and prevention. There is a lot of flexibility with it to tailor your treatments to each individual patient. And it helps to support their capacity to self-regulate and to heal. And for both the patient and the family, it can actually help improve a sense of control of the situation, improve their self-efficacy, and help with their resilience. There are certain conditions where we have stronger evidence for using pediatric integrative medicine treatments. So chronic pain is one of them, but asthma, allergy, some dermatologic conditions, IBS, IBD, constipation, URIs, certain mental health conditions, ADHD, definitely obesity, metabolic syndrome. And then there's some kind of common themes that benefit from a more pediatric integrative medicine approach. So inflammatory disorders, anything that has a nutritional component to it, which is pretty much everybody. Complex or chronic illnesses, and then any sort of illness where the patient and family feels increased anxiety and a sense of loss of control. But what does integrative medicine look like at PCH currently? Well, luckily, we're in pediatrics, and we are concerned about the growth and development of our kids, and we recognize that they often are not in control of their circumstances and don't have autonomy. So we tend to incorporate a lot of this into our practice as it is already, right? We're asking about diet and sleep and exercise and their environment and their exposures and bullies and all of that kind of stuff. So we're already practicing some of this as it is. Here at Phoenix Children's, we actually have a very strong multidisciplinary and family-centered care approach, both on the inpatient and outpatient side. And our pediatricians and hospitalists are working not only with our subspecialists, but also with our colleagues in social work, child life, nutrition, PT, OT, and then we even have music therapy, pet therapy, and a school teacher. So we really are using this fully integrated model. And whether you realize it or not, you may already be practicing some integrative medicine by incorporating evidence-based therapies. For example, using Medi-honey for wounds, or apple juice or pear juice for constipation for young kids. And so we're already using this at PCH. And the other thing I like to point out is that probably many of you are using integrative modalities for your own self-care or your self-care for your families already at home. And I wanted to just take a moment here and have you guys kind of throw out into the chat some things that you might be doing for your own self-care that would fall into this. So some examples would be vitamins, supplements, teas, dietary changes, yoga, meditation, breath work, mindfulness, aromatherapy, massages, acupuncture. So I'll give you guys a minute to throw into the chat and share what you're already doing. There's a lot of good examples of what you guys are doing, and there's some things that I didn't mention that I wanted to point out. So using apps to help you, like Headspace, definitely is a great one. Music therapy. So yeah, it looks like you guys are already doing quite a bit. All right, faith-based, spiritual things for self-care are also very helpful and important. So thank you for sharing that. All right. So moving forward, like Dr. Olson mentioned, I am starting a new clinical service line for pediatric integrative medicine, and it will be initially a collaboration with Pain Clinic for outpatient referrals, and there will be inpatient consults as well, and I'll go into more information about this at the end for you guys. It is not purely for pain patients, so definitely reach out if you have other patients that you think would benefit. Okay. So what is an IM approach to understanding pain? First of all, we want to do a very detailed intake. So we start with kind of the traditional H&P, but then do a deeper dive into nutrition, supplements, what their activities, sleep, are mind-body skills that they have already in place, spirituality, and environmental factors. And the goals are really to identify factors that are playing into their health, understanding where the family, or I guess assessing what the family's understanding is of their illness, and then identifying what their treatment goals are, because often we see that providers and families don't have the same goal in mind. You guys have probably all taken care of that patient where, you know, you want to treat the respiratory distress, but mom is more concerned about feeding this child who's been NPO for 2 days. So coming together on prioritization of goals. And then also identifying where the patient stands in terms of their readiness to make changes for lifestyle interventions or for new sorts of treatment options. I'm going to take a little bit of a step back here and sort of go through the evolution of how we think of disease in Western medicine and how that has evolved over time. So we start back with Hippocrates and the 4 humors and the imbalance of the humors leading to disease. And then eventually we discovered germs and identified that as a source of disease and got good at sanitation practices and antimicrobials and managing those diseases, and then started noticing that there are other new sorts of diseases that we are dealing with. And that is when we kind of started thinking more about genetics and environments playing into our disease. And I think now we're more in the era of thinking of disease in terms of inflammation, which we know affects so many different disease processes: obesity, cardiovascular disease, diabetes, dementia, Alzheimer, asthma, and allergies, IBD, so many different things that we deal with. So back to pain, some predisposing factors that can lead to more chronic pain or pain sensitization. So age of onset, children are having pain at a younger age can predispose you. When you look at specifically pediatric data, there is some data that suggests maybe older children versus younger children are more likely. Gender, female more than male. There may be some genetics involved in terms of polymorphisms in different pathways. Definitely diet, nutritional deficiencies, inflammation, mood and sleep disorders can definitely predispose you. Pain in the family can also contribute to child pain. And then adverse childhood events, either in the parent or in the child, can have an effect on illness and pain for the patient. And I'm going to pause here for a second and let Dr. Shroptaw step in and speak about adverse childhood events and the Center for Resiliency.
So my name is Amy Shroptaw. I'm the medical director of the Center for Resiliency Wellbeing, as Dr. Shukla said. What the Center for Resiliency and Wellbeing is used as a comprehensive lens, what we call eco-bio-developmental model, to understand how the dynamics of the child, teen, and family affect the development, health, and lifelong well-being of the child and the family. It looks at the relationships, genetics, experiences, and the environment to basically get a better picture of how to take care of the child and the family. We use a care model that's a little bit different than what we have used in the past. So in the past, we've used something called an integrative model. It's the coordination of physical and mental health care all in one setting. And it's basically a disease care model where treatment occurs after disease has already manifested. In our program, what we're using is also the integrative model, where it's a preventative care and we address the mind, body, and spirit. It encompasses the conventional care as well as complementary health care that is evidence-based, and it accounts for the eco-biodevelopmental factors, as I said earlier. So now, why is this important? We know that right now, healthcare is very costly. In the United States, spending grew from 9.7% from 2020 to a $4.1 trillion. And the price of medical care is the single biggest factor with chronic and long-term medical conditions causing the problems. And as Dr. Shukla was talking about, one of the main things that we think of in medicine right now is the inflammatory process that goes in our body that actually goes from what occurs in the childhood and what we experience and into what we call adult onset disease. And we find that if we put more money in, prevention costs less than treatment does, and especially from an early age. And so in the program that I'm in, the big thing we look at is adverse childhood experiences. And from a study back in the 1990s, it shows that about 12% of adults have experienced 4 adverse childhood experiences, so abuse, neglect, and things that are within the home. If we were able to spend money and reduce the negative outcomes in adults by looking at adverse childhood experience and doing some preventative care, as you can see in this graph, it would decrease these diseases, adult onset diseases, by significant amounts. So depressive disorder by 44%, what we talk about heart disease as 13%, just by addressing adverse childhood experiences. And by addressing these, current smoking by 33% and heavy drinking by 24%. But it also would look at the socioeconomic challenges that are occurring today. So we see here that how this works is that our body's nervous system are always looking at the things around us to keep us alive. So when we talk about a threat, it fires down into our brain and it causes a release of cortisol and epinephrine by going through the autonomic nervous system and what we call the HPA axis. And through this, it increases our glucose, increases our heart rate, blood pressure, and causes inflammation. Now, this is important when we have a threat because these are the things that actually allow us to meet the moment and be able to respond appropriately for survival. But we also know that this system is only designed to last for about 20 minutes. And probably the biggest part is it should only last about 5% of our time of our day. But most of us in today's society where it's fast-paced and things are going on, we live in this mode more and more than 5%. And so when we look at this system, and this looks a little complex, but what we find is that in this stress response, again, where we have the threat that feeds into the brain and goes down these pathways to cause adrenaline, epinephrine, norepinephrine, and cortisol release, there's also things called regulators. And this is where we look at this area of the end organs where the heart rate goes up, feeds back, and says, you can slow it down. Our vagus nerve, I saw that some people wrote on there that they do breathing exercises, which affects the vagus nerve. And then we have things called with cortisol feedback that goes back and says, you don't need to keep releasing cortisol to calm it down. And these are what we call the regulators. And so in integrative medicine, and what we try to do in our program, is we look at these regulators and say, what are the things we can tap into that actually go back and calm down these responses that cause inflammation and feed the sympathetic nervous system? Okay? In contemporary, and even today, counseling and psychiatrists, it's a great way, and most people do need help in this sense, but it is not the only way. So what we find is that there's evidence-based treatments and tools outside of just viewing a counselor, LCSW, psychiatrists, and psychologists. There's other things like these simple things that we take for granted that we don't think that really go back and feed into the body and the brain to calm it down. Go for a walk. Walk with somebody that you care about. Okay? Yeah, it's the time for connection. Taking time with a pet. It's what pet therapy shows, that there is some great things that do to help to decrease the hormones and chemicals. Yoga, mantras, meditation, prayer, okay? And even things like this of physical exercise. It's not just to help the heart, but we know that physical exercise works on the end organ to actually feed back and calm down the central nervous system. And so in our program, we developed some ways, some tools to help our children, to teach them that if you can't get to a psychologist or a psychiatrist, even though you may need it, there are things you can do at home to help in this way, to help calm this nervous system. And so we developed some of these cards, and this is just an example of one of them. We put on there about the different moods that you have that can help, giving a mantra to help the feedback that actually helps with what we call intention, brings your attention to what you're feeling, and then some breaths that these children can use to go into the vagus nerve to calm down that nervous system. So Dr. Shukla, I'll send back to you.
So we'll take a look at the integrative medicine approach to treatment of pain. It really does take a village to raise a child, and it takes a village to take care of a child and their family that are experiencing chronic illness or pain. Again, I want to emphasize that we are practicing evidence-based medicine here, and we are looking at efficacy and safety, and this model can help you sort of determine treatment options for your patients that you might want to recommend, or if they're asking about them, and looking at the data in terms of safety and efficacy. So definitely, if it's safe and efficacious, recommend it, monitor, see how things are going. If it's not safe, if it's not efficacious, discourage families from continuing that. And then the other two categories is going to take some judgment call. If it is safe but not really efficacious, you might be willing to tolerate it, as long as it's not wiping out their pocketbooks or something. And then if it is efficacious but maybe questionable on safety, it's something you might want to consider, but definitely use it cautiously and continue to closely monitor your patients. So acute pain in neonates, I'm going to do a quick case, and again, you can throw your answers in the chat, and there may be more than one right answer. You are seeing a 3-week-old term, previously healthy male for fever, vomiting, and dehydration. You determine that he needs a full rule-out sepsis evaluation and IV fluid resuscitation, meaning he is going to get poked for blood draws and an IV placement. He's going to get a lumbar puncture, and he's going to get a urinary catheter, all of which are very painful. So which of these following methods has been shown to decrease the pain response in neonates? Again, you can just put your answers in the chat. So it definitely looks like people are leaning towards all of the options, maybe swaddling. Sorry, my screen keeps getting frozen. Okay. So we do know that there's some growing evidence for adverse outcomes in the long term in terms of neurological development for infants who are experiencing pain, particularly those who are in the NICU and undergoing numerous painful procedures. And so this is a population that we sometimes don't think of as often about managing their pain, but I want to emphasize that we should be addressing it more. So there is evidence to support that environmental control, so skin-to-skin care, swaddling, even massage or music therapy, definitely not heavy metal, but maybe something soft and slow and soothing, can help decrease crying time and pain scores in neonates. And then when you look at different feeding methods, there's some surprising information. So breastfeeding and non-nutritive sucking, so that could even be just like a gloved finger of the provider while they do the procedure, are both associated with reduced pain scores and crying time with vaccinations. Formula feeding has not been shown to decrease pain scores, but expressed breast milk through a bottle has. And in preemies, there are some studies that suggest that even just the scent of breast milk can reduce pain scores by 50% during venipuncture. Sucrose, which we use quite often at Phoenix Children's, I was surprised to find that there's actually conflicting data on pain reduction acutely. However, there may be some benefits in terms of their spatial learning and memory regarding pain, which could potentially affect long-term pain. We don't know some of the more long-term effects of using sucrose for pain management in terms of using sugar to treat pain and maybe effects of diet and obesity down the road. But it is still a pretty good option, and anecdotally, we definitely see it helps. Non-invasive acupuncture, so acupressure, for example, has some evidence for decreased crying and pain in heel pricks for neonates, but there do need to be some further studies. So acute pain management in children. You are the PCP for a 10-year-old female who will soon be undergoing an elective surgical procedure, and parents are asking you how they can help her prepare for the procedure and to help manage her pain and her anxiety. What options could you recommend? And again, you can put your answers in the chat, and there may be more than one correct answer. Definitely people are leaning towards child life consults, which we do quite often here at Phoenix Children's. We're very lucky to have them as part of our team. So quick reminder, you have non-opioid pharmacological interventions for acute pain management. And I don't want to go into the pharmacology. I will save that for pain team. And if you have more complex patients, I suggest you consult them. But you can go with your nociceptive analgesics, which would be like your Tylenol, Motrin, steroids, neuropathic analgesics like gabapentin, clonidine, and then local anesthetics. And then when you look at integrative therapies, there are definitely studies that can show reduced perioperative pain and anxiety, but also some evidence that suggests that you have decreased reliance on opioids and even length of stay in the hospital. So which of these actually are helpful? So we talked about child life specialist or even a psychologist consult. They can help educate our patients about what the procedure is, what the expectations are for pain, and do it in an age-appropriate manner. They can also help teach them some behavioral pain management like relaxation, breath work, those kinds of things, and provide distraction techniques which work really well with children. Acupuncture actually can have a role in both pre and post-operative management. It can help with the anxiety, definitely can help with post-operative pain, can decrease opioid use, and it also can be helpful for post-operative nausea and vomiting, which is often associated with anesthesia and pain medications and even the procedure itself. Children actually are great candidates for hypnosis or guided imagery. I recommend that this be taught to them with an experienced, trained professional, but it can actually help them decrease pain and anxiety with procedures and help increase their self-efficacy, because you can then teach them how to do self-hypnosis or to go through a guided imagery practice on their own. Melatonin actually has had some evidence in adult studies to show decreased perioperative anxiety and pain when you give it to them the night before the surgery. So having a good night of sleep definitely can make a difference. And then nutrition we'll talk about later, but optimizing nutrition perioperatively can be helpful, not just with healing, but also with pain. And we'll talk more about that later. So now I'm going to talk more about some chronic pain therapy options. The goal for dealing with chronic pain is pain management. We're not trying to eliminate their pain. So setting that expectation up front is important. We're also trying to help them increase their function, their independence, and help to improve their coping and their resiliency and well-being overall. So these are some kind of broad categories that we'll cover. In nutrition, we think about diet. My number one recommendation is to avoid the SAD diet, which is the standard American diet, right? Highly processed foods, high sugar, high content of unhealthy fats, and low on your just good old-fashioned fruits and vegetables. Some of our patients do experience more inflammation and pain with particular foods, and so you may be considering prescribing a specialized or an elimination diet for them. And I would strongly recommend, if you are considering this, then to refer them for allergy or sensitivity testing and to make dietary changes with a dietitian involved so that you can make sure that they're getting the macro and micronutrients that they need. When in doubt, my go-to is an anti-inflammatory diet. I think it is, for the most part, a safe option for pretty much anybody. And this pyramid over here is Dr. Andrew Weil's anti-inflammatory pyramid. And as you can see, it has a very strong base of plant-based foods, lots of fruits and vegetables, healthy grains, beans, legumes, healthy fats like avocados and nuts and olive oil, soy foods, which soy is one of the few plant-based foods that is a complete protein, but also has some evidence for long-term health benefits, especially when started at a younger age. And then having a smaller amount of animal products, but healthy choices for your animal products. And then you can incorporate teas and healthy herbs and spices. I would say if you have a patient who is on numerous medications to maybe consider how these are metabolized, because some of them can affect those pathways and affect metabolism of anticoagulants or OCPs and other medications. And then, of course, a little bit of healthy chocolate. It's always good. When you're thinking about macro and micronutrients, first of all, kind of think about specifically related to your patient, what deficiencies they might be experiencing. So due to their underlying illness, for example, cystic fibrosis kids have an increased metabolic need overall, but they also have decreased absorption of their fat-soluble vitamins needing supplementation. They may have poor intake due to their illness or their pain or maybe nausea from their medications. And then you may have other medication-related consumption of nutrients or decreased absorption of nutrients. For example, PPIs can lead to decreased absorption of your B vitamins. Micronutrient deficiencies can be associated with pain. Some common ones that we think about are vitamin D deficiency, magnesium, which can impact pain through modulating the NMDA receptors and also can affect sort of the comorbidities associated with pain. Deficiency in magnesium is also associated with an increase in CRP. Your B vitamins, when deficient and you supplement them, can be helpful for neuropathic pain, migraines, fibromyalgia. And then omega-3s are shown to reduce your markers of inflammation, which can affect pain. When you're thinking about your perioperative period for patients, optimizing their nutrition absolutely can make a difference in their outcomes. Vitamin D is, again, commonly deficient. In adult ortho studies, it is associated with increased post-op complications if they are deficient, and supplementation actually can improve outcomes. And it is low cost and it is safe, so why wouldn't you check levels and help supplement them if they need it? Albumin as a marker of your protein is also another important one to think about. Even there are some studies in adult patients undergoing cervical spine surgery that suggest that even 1 point increase in your albumin can reduce or is associated with reduction of complications by 60%. And protein is relatively easy to increase quickly. So if you have an elective procedure coming up, you only need a few days of increased protein to make a difference in that amount. Or if you have an inpatient, we'll often see where we try to optimize their nutrition enterally or through IV nutrition before surgery. One thing to think about with omega-3s is they can have a blood thinning effect, so you may have to hold those pre-op. So exercise is one of our most powerful tools that we have for chronic pain and increased sensitization, but it's often associated with anxiety because patients are afraid of flaring of their symptoms and often end up then in a vicious cycle of fear and exercise avoidance and progressive weakness and increased pain. So it's very important to really work with that individual and tailor their exercise regimen, set realistic expectations about what they are able to do so that they're not overdoing it, but also that initially they may have some pain and that as they work through this and get stronger, it should improve. Helping to manage their anxiety around this situation and then go slow, titrate slowly, and allow time for recovery. There are studies in adult fibromyalgia patients that show that Tai Chi outperforms aerobic exercise in terms of reducing pain and fatigue. It is a very low impact, slow movement exercise, so it is well tolerated. It also is helpful for increasing balance. And because it is a very relaxing form of exercise, it has shown to decrease autonomic dysfunction and sympathetic overdrive that we see with some of our chronic pain patients. Surprisingly, in studies with yoga in kids with pain, they don't report a lot of benefit from it. However, it is, again, another low impact exercise regimen, and if they tolerate it and enjoy it, it is another one that will help with strength building and balance and function. So it is definitely one that you could still recommend. Mind-body therapies available for kids. Cognitive behavioral therapy, one we're all very familiar with and use often, and it is well accepted by patients and providers both. Mindfulness exercises, I apologize, I'm a little under the weather today. Mindfulness exercises have a lot of supportive evidence in adults and some promising data in children. We do still need some more studies to say for certain, but it is low cost, it's safe, and it's very readily available through apps and videos and things like that. So why not recommend it? Hypnosis, again, we know it can be helpful in the acute pain for kids, and there's a growing literature for chronic pain as well, and it's definitely well established in adults. It helps promote self-regulation, self-efficacy, a sense of control over the situation, so it can be a good option. And then biofeedback has some good evidence for kids with migraines and tension headaches, and there's strong evidence in other pain conditions in adults. I think we need some more studies in kids, but it's probably a good option for different pain conditions. The challenge with biofeedback is it can be expensive for clinics to have the equipment to do it. We can do some sort of basic biofeedback techniques with families with all of the smartwatches and phones and things that we have, which monitor heart rate and heart rate variability and respiratory rate. So there may be some ways to incorporate that as well that are less expensive. And then manipulation therapies, PT-OT we all know and use frequently. We kind of lump together here osteopathic, craniosacral, and chiropractic modalities. They're all a little bit different, but they have evidence to support use in children with chronic pain, especially kids with some physical disabilities. It can help improve pain and function. Massage has shown to reduce pain and increase muscle relaxation in venipuncture, patients with JIA, patients with burns, and who need dressing changes. And then acupuncture, I'm going to let Dr. Genovese take over here and talk more about acupuncture and what she does with our pain clinic.
So let's start. This is a 5-minute crash course in acupuncture, so bear with me. To understand acupuncture in the way that Chinese medicine understands acupuncture, we need to talk briefly about the 3 pillars of the theories of Chinese medicine: yin-yang, 5 elements, and qi. For the yin and yang, I think we are all familiar with, at least with the symbol. It means that they are opposite but complementary qualities. Each can be itself and it can be the contrary, and one has a little bit of the other in it. It's different than the Western medicine where you think that one thing cannot be the other, or you are sick or you are healthy, or you are blue or you are red. In this case, you can be one and the other and transform and consume at the same time. The yin and yang is, there is a Chinese symbol. It's not this one, but it's a character that shows that it's the top of a hill for the 2 sides. One side that is the dark side and one that has light, and that is what it means. Yin means the dark and yang is light and everything that is related to it. For us, symptoms of the symptoms that we see, there are a deficiency or an excess of yin and yang, and we treat it that way. So these are mostly what in the way that they correlate. Yin, like I said, is dark, night, rest, is west for the sunset, north, right, earth. And in the body is the front and medial, like chest or the abdomen in the front, the lower limbs, everything below the waist, and they're the structural part of the body. And the yang is the complete opposite. Is light, day, activity, east for sunrise, south, left, heaven, is the posterior part of the body, including the head and the back, above the waist, and mostly about function. The other theory is the 5 element theory. At the beginning of this theory, and when they start to think about this, they start to shift the way that they think about diseases from evil spirits causing maladies to start to think about a cause-consequence of the disease, and something that we do also in Western medicine. The 5 elements are water, fire, wood, metal, and earth. They have a generating sequence that you can see with the gray arrows, and they have a controlling sequence that you see with the red arrows. Every single channel, and we're going to talk about channels in the future, those are the famous meridians, correspond to an element. And when we have a symptom, we have to assess what's the channel, what is the element, what channels are we going to use, and if we're going to generate or we are going to try to control the sequence. The chi, the best way to describe, if any, is the vital energy of each person. This is a constant flux of the body and the mind. They don't separate. It's similar to yin and yang. They don't separate, or the body or the mind. It's all one. We cannot separate, like we cannot separate in our body or our soul. They consider all together. When it's more condensed, it's as a physical shape. When it's more dispersed, it's going to be a more ethereal form or energy. Can be material or immaterial. It's the same as flesh and spirit, body and mind. When the chi has an issue or a pathology, it can be deficient, can be sinking, stagnant, or rebellious. And depending on the physical symptoms, we have different protocols to use. The other thing that you need to know is the chi circulates through the body in different ways, and one of the ways are the channels of energy. These are the channels or meridians. These are more or less defined as the invisible channels through which the chi circulates through the body. There are 12 primary meridians, 8 extraordinary vessels, and there are other connecting channels that are minor. If you see the names of the primary meridians, you think that is related to that area. Is not. So they just name it that way. And remember, meridians are a way that they have to explain the different signs and symptoms that they found and how they are correlated with the body. These are the body meridians, just briefly. Now let's go to the next question, is how to acupuncture works. I think there are different ways to see it. Long time ago, 800 years BC, the Chinese tried to understand what was happening with the trial and error of the clinical placing of the acupuncture needles. And the best way that they find to do it is to find those meridians, finding that if they put a needle in one place, it's going to cause this or that consequence. But remember that they didn't have any knowledge of the deep human connections, the body, and let alone what is the neuronal part or the hormonal part or the molecular part of the connections. But I think, all in all, they did a great job trying to understand what was going on with the body. So we have that way to think about medicine, think about acupuncture, the more traditional way to think. But what we found doing studies in the last 50 years is that many of the points, actually pretty much almost all the 320 plus acupuncture points in the body, they are or on a nerve pathway or very close to it. So knowing that, there are areas if they did several studies, one of them was to dissect cadavers with the points of acupuncture, and they found that below the acupuncture point, they are the areas or more rich innervation in the deep tissues that you cannot find in points that are away from the acupuncture points. So knowing that, and knowing that this was only trial error what they did, I think they did a pretty good point. The other thing that we also know through more modern studies is that electroacupuncture stimulates nerve fibers, A beta and A delta fibers. Manual acupuncture, that is the traditional acupuncture, stimulates the same fiber plus C nerve fibers. So now, other studies show that with functional MRI, it shows in the points of acupuncture, you can elicit a pain response in different areas of the brain. There are several studies about this. I just listed one of them there if you want to read about it, showing that the acupuncture has not only a local phenomenon, but a more central nervous system impact. There are other studies that shows that the stimulation of these acupuncture points could cause a stimuli in the nerve that lead to neuromodulation. There are studies that show that there is, with acupuncture, you have a presynaptic inhibition of the release of the substance P and glutamate, and a postsynaptic membrane hyperpolarization in the nociceptive neurons in the dorsal horn. All that says they block pain signals in the presynaptic and in the postsynaptic neuron, and that causes an increase in the pain threshold in the patients. This has been seen in acupuncture that has been done in for several months. It's not only a short course of acupuncture. So the more you do, the more that you can neuromodulate that area. Another study shows that acupuncture works releasing endogenous opioids like enkephalins, beta endorphins in the dorsal horn of the spinal cord. They have at least there are two studies that I found it interesting, both in the 1970s. In one, they use rabbits. They put acupuncture. They use needles in the acupuncture point for rabbits. Then they took the CSF fluid and they transferred to rabbits that didn't receive any acupuncture. And what they found in the rabbits that received the CSF fluid is that they have an increased threshold after that transfusion of the CSF fluid. There is another study also in the 70s that shows that naloxone partially reversed the analgesic effect of acupuncture, showing one more time that it's working in these endogenous opioids. And the other way that I personally think that also works is a direct stimulation of the fascia of the muscles or the muscle itself, similar to what we have with trigger point injections or we have with dry needling, but in a more gentle way. After reviewing several studies, what I realized is that it's very difficult to get to a good clinical trial that to prove that acupuncture works, because that depends in so many variables. But if we investigate more at the cellular and molecular level, it becomes more scientific and less esoteric than we probably were thinking before. All right, so this is probably how you guys think that acupuncture looks like. It's not, sorry to break it to you. This is actually the size of the needle of acupuncture. You can see this facial acupuncture. I use even one that is 0.10 millimeters for my patients, because many of my patients, at least they have an increased sensitivity, so I have to be very gentle with them. And this is how it looks. It's just a few needles in the right places for 15 or 30 minutes, once a week, once every other week for a couple of months, and then a maintenance treatment. So for applications of acupuncture, it depends who you ask. If you ask an acupuncturist, they're going to say they can treat anything under the sun. Personally, I personally know that helps with headaches, any musculoskeletal pain, anxiety, depression, addiction. There are several studies about asthma. I personally didn't treat anybody with asthma, dental pain, and vomiting for chemotherapy or post-op. And of course, we all have these patients, right? It doesn't matter what we do. Nothing gets better. So how to refer patients to us? Through the comprehensive pain clinic. You can place a referral for an evaluation of pain. We have an outpatient order. You can email me to make it easier, or you can call the pain clinic. And this is the order because it's a little hidden. It goes for interventional pain, and you just type acupuncture here. That's what I got. Thank you, guys.
To summarize quickly, integrative medicine is a relationship-focused approach to the whole patient, taking into account all factors that could play into their health and integrating appropriate evidence-based complementary and conventional therapies into a very personalized treatment plan. The use of multimodal therapies and a multidisciplinary team can help in both acute and chronic pain and lead to reduced pain, decreased opiate use, increased function, increased sense of control and efficacy, and better quality of life for both the patient and their families. And while we do still need increased research specifically for pediatric pain management, there is a lot of data out there in adult literature and some preliminary studies in pediatrics regarding safety and efficacy, and you can use this data and think about your safety efficacy algorithm to make decisions about treatment recommendations. So coming soon, you can consult Pediatric Integrative Medicine, and I will keep you guys posted as soon as we're fully up and running. But there will be an outpatient referral order, and then there will be inpatient consults available. But regardless, even in the meantime, you can always contact me with any questions that you have. References, any questions?
Thanks, Dr. Shukla, Dr. Shapta, Dr. Genovese. Very fascinating presentation. We are just about out of time, but if folks have questions, please do enter them in the Q&A or the chat. Was one question that came across about access coverage for some of the therapies mentioned today. Dr. Shukla, do you? I'm not sure if you saw that question, but I think it was when you're talking about some of the cognitive therapies, but really for all the therapies mentioned. Can you speak to the insurance coverage?
It depends. To be honest, certain things like acupuncture, access probably won't cover. Your private insurances might, and Dr. Genovese could probably speak to this more. It depends on what the diagnosis is, the reason for it, whether they'll cover it or not. Some of these other treatments, again, if you are credentialed to provide some of those therapies, you may be able to bill for them. But again, I think it varies depending on what insurance the patient has and what their diagnosis is. So that is definitely one of the challenges of practicing integrative medicine.
I can tell you more about acupuncture. It usually doesn't cover the other commercial insurance. They tend to cover up to a certain point. And what we try to do is to try to make it more available for the patients. If you are going to an acupuncturist outside in the community and it's a private session, because you have community acupuncturists that they put you in a room and with many other people. But if you want a private in the way that we do it here is above $100. And we try to make it more affordable at $50 per session. That is less than half of what is charged. I know it sounds a lot for our patients, but that's the best that we can do. And many of them, they prefer to pay the $50 instead of using their insurance because they sometimes cover completely and sometimes they have a copay. And we run everything before we accept a patient so they know upfront what are the costs. Yeah.
Well, guys, we are just out of time, so appreciate the presentation this morning. Dr. Shukla, any final thoughts?
So thank you for letting us present this, and thank you to Dr. Genovese and Dr. Shoptail for giving their expert opinions as well.
Well, best of luck with the clinic.
Thank you.
Have a great day, everybody.